Hey guys, welcome back. It's Adam the Science Tutor, and today we're going to be covering the heart, the four chambers of the heart, and where the blood's coming in to and where it's going out towards, and the different areas of the heart. So we have four chambers, and when talking about the heart, there's a couple things to keep in mind, or at least when drawing it, you're going to draw the anterior heart, or anterior surface of the heart, so it's as if you're looking at my heart. So when drawing it, it's going to be left and right for orientation. And just the things to keep in mind is that veins go towards the heart, and arteries go away. So I like to think of A for arteries, away. So arteries go away from the heart, and veins go towards the heart. So to get started, we're going to have two different bottom chambers. And this one. Alright. And these are going to be called ventricles. So this is your ventricle. So you have your left ventricle and right ventricle. And ventricle is pretty much an area where your blood's going to rush into. It's going to have different valves, but it's going to rush into it. And these are the bottom chambers of the heart. And so I'm going to do just a quick, these are going to be your valves. So we have a valve there, a valve here, a valve here, a valve here. So the valves are a signal to that there's going to be an attachment of some sort. And I'll talk to you about those in just a bit. You're going to have the bicuspid valve. Bicuspid because there's two latches, two doors. So there's a bicuspid valve on the left ventricle. There's the aortic valve, the pulmonary valve, and the tricuspid valve. So it's tricuspid because it's three doors. So we're gonna have two compartments up here. So okay, and these are gonna be your next two chambers of the heart. So these are gonna be your atrium. So it's your atrium. And on the atrium, you're gonna have a bigger muscle on this end and a small one right here. So, and then the muscle on the atrium is called the auricle. So I'm gonna put that in parentheses. The auricle. And so you may, like, I'm gonna draw this out a little bit bigger just for abbreviation. So this atrium is the right sided atrium is gonna be much bigger. We're gonna talk about why in just a bit. The left atrium is gonna be much smaller, but it's gonna have a larger auricle. And it's all for the processes, which we'll talk about in just a sec. We're also going to have a muscular layer on the heart. It surrounds the heart. And then it's going to be much thicker on the left side for a similar reason why we have a larger auricle on the atrium. But we're going to get to that in just a second. I'll get to the naming of that muscle in just a second as well. We're going to draw out the different trunks and the branches and the veins of the heart. So on the left side of the heart, on the atrium, we have two valves. So the valves work in pushing blood in a unidirectional way. So blood's only traveling on one way. So we have the bicuspid valve, and we're gonna have 1, 2, 3, 4. So these are gonna be your pulmonary veins. You're gonna have 4 of these. Pulmonary veins are going towards the heart, so that's going to tell us something about the blood flow, which we'll get to in just a sec. So we have our pulmonary veins. Let me erase this line for the atrium. So, and that's connected to the atrium. The atriums work almost like reservoir valves. So they hold a bunch of the blood, and then they let it pump into the ventricle once it is ready, or once the valve's open. So we have pulmonary valves attached to the bicuspid valve. So we have a bicuspid valve that works in unison with pulmonary veins. And then I'm going to draw over our auricle. We have our big main guy right here, and it's connected to the aorta valve. So what could that be? It's the aorta. So we have the aorta right here. Aorta, and it has the aorta valve. So you have the aorta and the aorta valve. The aorta is big time player in the game, but we'll talk about what it is actually doing, where the blood's going to in just a second. We're going to finish up the valves. So on the right side of the heart, we have a right ventricle, a right atrium, a small auricle, and on our pulmonary valve, we're going to have, guess it, it's going to be a big pulmonary trunk, which is an artery going in two different directions. And then on the tricuspid valve, we're going to have, it doesn't actually look like this in the heart, but just for simplicity's sake, we're going to have the vena cava veins. So you're going to have the pulmonary trunk, and that has the pulmonary valve to open it. And then right here we have, it's a big vein. It flushes all the blood, all the deoxygenated blood out of our body pretty much. It's the vena cava. So we have the vena cava. This would be the superior vena cava, and this would be the inferior vena cava. And this is the vena cava that pumps right into the atrium, the right side of the atrium. So now now that we have the structures down a bit, just to rerun real quick, we have our bottom two chambers of the heart, which is our left and right ventricles, our left and right atriums, and inside the atriums we have a muscle there called the auricle. We're going to have a larger auricle on the left side, a smaller auricle on the right side, and we're going to have a not much bigger, but quite a bit bigger atrium on the right side as opposed to the left. And I'm going to get to the nitty-gritty details in just a bit about that. But for now, let's talk about blood flow and where it's going, where's it emptying at to. So for red, I'm going to use red for oxygenated blood. So oxygenated blood. So pulmonary veins are going towards the heart. You're going to have these pulmonary veins, and there's 4 of them. So these 4 pulmonary veins are going to pump blood, oxygenated blood, through this bicuspid valve, and it's going to fill the left ventricle about 2/3 of the way. And once it fills about 2/3 of the way, it's going to need help to push this oxygenated blood into the heart or into the ventricle to fill the rest of it up, so it could go within and up into the aorta. And this branches out 3 ways. And it goes into the aorta through the aortic valve, but it needs the help of the deeper muscle layer around the heart so it can push this pressurized oxygenated blood up and into the heart. And we need a bigger auricle. The auricle works like a muscle. It pumps the blood from the pulmonary valves, or from the pulmonary veins into the ventricle, and then outside of the ventricle it'll go to the aorta. And this supplies our entire body with all oxygenated blood. So all our oxygenated blood, from our ears to our toes, everywhere else in between, comes from the aorta. So you're going to need a bigger muscle system, a bigger muscle layer around the left side of the heart, and you're going to need a bigger auricle to make sure all that blood goes exactly where it's supposed to go. You need it to push oxygenated blood a further distance from the heart to where it's going. So this is a further distance. So you need, so over here. So you're going to need, for oxygenated blood, it's going to go a further distance. And it's going to be needing more muscle, bigger auricle. So it has more muscle, a bigger auricle, so it can push the blood, our oxygenated blood, everywhere through our entire body. And that's going through the aortic valve. Now for our deoxygenated blood, I'm going to draw it blue. So deoxygenated. And it doesn't actually look blue, but for simplicity and for cartoon's sake, we're going to draw it in blue. So you have the vena cava veins. It's going towards the heart. And you're going to get all the blood in our body from the superior vena cava. So all our blood flow drains into the vena cava, and that all drains into our right atrium. So that's coming from our superior portion of our body. And then our inferior vena cava is going to get all the blood from our legs or toes, and it's going to pull all that blood, and it's going to pump into this large atrium. It needs to be large because of the fact that there's so much blood going into it This does not need to be as large because you're only getting blood, which you'll see in this closed cycle, from the lungs. So it needs to be a much larger atrium than as opposed to the left. So it's getting a lot of blood. It's getting all our deoxygenated blood, and it's going to come through this tricuspid valve, and it will also fill about 2/3 of the ventricle. And then once it fills about 2/3, it's gonna, and this is what confuses people, it doesn't need as much muscle, or it doesn't need as big of an auricle because it's deoxygenated, so it doesn't need as much pressure to push the blood. The blood isn't as heavy. It doesn't need as much pressure to push this blood, and it's not going as far as we'll see right now. So it's going to go up and through this pulmonary valve into the pulmonary trunk. It's going to branch off 2 ways, and it's going right into our lungs so that it can be oxygenated. And then when it's oxygenated, it's going to go, you guessed it, so this is our pulmonary trunk, which is an artery. It's going away from our heart towards our lungs, and it's going to come back to the heart in the pulmonary veins, oxygenated now, and it's going to repeat this cycle. It's almost an endless cycle. So cool. So some things to take away about deoxygenated blood: you need a bigger atrium, less muscle because it's deoxygenated, less pressure. And why do we need a bigger atrium? We need a bigger atrium because it's like our reservoir for the ventricles, so it fills up with blood when the ventricle is about 2/3 of the way full, and it allows the rest of the blood to empty into here in a timely manner. And this goes to the lungs. So this is another reason why we need less muscle, because it's only going to the lungs, so it's not traveling very far. It goes from your heart to your lungs. It's a short distance, so you don't need too much pressure, you don't need too much muscle to push it that far. Cool. So let's talk about the muscle layers right quick of the heart. The muscle layers, I'm gonna draw in green and black. Remember green? So we have this muscle layer across. I kind of slightly talked about it. It's gonna be thicker on the left side because that's pumping your blood everywhere. It needs a lot of pressure, it needs a lot of force, it needs muscle to move it a great distance. The oxygenated blood is delivering to your entire body, our fingertips, even everywhere. So you're gonna need this muscle layer across, around it. It's gonna be called pericardium. Peri, that means around. So peri, it's around the heart. Cardium means heart, so pericardium, around the heart. And then we're gonna have endocardium. Endo stands for inside the heart. So endocardium, endo within. Endocardium lines the muscles of lines the ventricles. So it lines the ventricles, and what it's good for is it allows the ventricles not to overexpand. So if you imagine if you busted a ventricle, or if it overexpanded, it would be not good. I mean, it would lead to poor consequences. It would be kind of disastrous. So this allows it encloses your ventricles so that they could limit the size and that they're not overexpanding or overexerting themselves. So you have the endocardium. Pericardium's function is to help push the blood in a certain direction and make sure there's enough pressure to push the blood to our entire body. And then we also have myocardium. Myo means muscle, cardio means heart, so it's muscle of the heart. This just fills in all the gaps. And this also, it's all myocardium. This also helps with pushing the blood where it needs to go. So myocardium, pericardium help push the blood where it needs to go. Endocardium, make sure that we don't overexert or overexpand the ventricles. So I know we're covering a lot, so let me just run through it again. Make sure you guys have it down. So we're gonna start. Let's start on this side. So our ventricles, or not our ventricles. Our ventricles, yeah, are both. We have 2 ventricles and 2 atriums. The atriums also have an auricle. It's a piece of muscle that helps push the blood. The ventricles are going to be filled with blood. So on the right side of your heart, It's going to take deoxygenated blood from your vena cava, superior and inferior, and it's going to drain directly into the ventricle. About 2/3 of it is going to fill up with deoxygenated blood, and then it's going to open up the pulmonary valve, and it's going to go straight up into our lungs. Our lungs are going to oxygenate the blood, and through the pulmonary veins, there's going to be 4 of them. It's going to come and dump into the atrium. The bicuspid valve is going to open, and it's going to push the blood, 2/3 of the blood, into the left ventricle. The left ventricle is then going to be squeezed and pressured and push the blood with the pericardium and the bigger auricle up into the aorta, and the aorta is going to distribute the oxygenated blood for our entire body. So, and it also doesn't need a big atrium because it's only getting a small, imagine all the blood in your lungs, you're only getting a small portion of blood as opposed to the entire body dumping out into the right atrium. Alright, cool. So that's that. I covered most of the basics of the heart and the blood flow, but let's talk about the valves. The valves are very interesting, and they are very important so that we don't have backflow and that we don't, so we don't have blood backflow. So we want, for a purpose of a valve, is the closing and opening of like doors. So it's like bicuspid valve or tricuspid valve, and you have our 2 named valves, which is the aortic valve and the pulmonary valve. So they open and close and allow for unidirectional, so one direction flow of blood. If you have them opening and closing at wrong times, that is, you're going to be dead. It's going to be prone to disaster. So let's talk about what the valves are. So I'll draw them out in black here. Let's see. All right. So I'm gonna take a picture if you want, but I'm gonna erase some of this information on the deoxygenated blood. That way I could draw out these tricuspid valves and bicuspid valves. So the valves work almost like doors, nearly like doors, and they have certain muscle and tendons called chordae tendini that hold these doors closed and opened. So there's chordae tendini, which is a tendon that branch off and hold these valves closed and open them when they need to be open, called chordae tendini. I might be wrong on that spelling there, so check me out, but it's chordae tendini. And then the muscle that you're going to have that assists the chordae tendini in opening and closing of the valves is papillary muscle. Papillary muscle. I didn't spell out muscle, but that's okay. So you have papillary muscle and chordae tendini that help open and close these valves. That way we can only have unidirectional blood flow, and that we don't have any backflow of blood. We don't want the blood coming from our ventricle and just going back into the atrium. We want it to go one way. So I want all my vena cava blood to go straight into the ventricle, and I don't want any of that blood going back out. I mean, that would be disastrous. So a kind of cool thing about the valves, little trivia knowledge, I guess, is that I know you guys have heard lub dub. If you put your hand or ear close to someone's chest and you listen for it, you could hear a lub dub, lub dub, lub dub. So this is a cool concept because it gets us understanding when do the ventricles fill, when do the atriums fill, and how do we know, I mean, is this one going on and then this one, like whose turn is it, who's going first, who's going second? So lub dub is a cool way we can kind of get that understanding. So with our bicuspid valve and our tricuspid valve, that's going to create the lub sound. So the valves are going to create the sound. So if the tricuspid valve and the bicuspid valve are making the lub sound, that means they're working in unison. They happen at the same time. And how is this sound created? How do the valves make lub sound? So I like to think of it as clapping. So when I open my hands, I don't hear a noise. But when I clap them, I close them, I make a noise. So same things with the valves. When they open, no noise. When they close, they make a noise. So every time the valves close, on the bicuspid valve and the tricuspid valve, which is receiving blood from the veins, it's going to make a lub sound. So that's how we kind of get the idea of when do these occur. Well, the tricuspid valve and the bicuspid valve are occurring at the same time. So as soon as the pulmonary veins are pouring blood into the left ventricle, the vena cava is pouring blood into the tricuspid valve, or through the tricuspid valve into the right ventricle. And you're going to have the noise lub, 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 lub. So we know that is happening at the same time. So it's lub dub. So when does the dub sound make or happen? Well, it's when the blood is going up into our lungs. So whenever the pulmonary valve and the aorta valve open, we don't hear a noise. No noise, dub, dub, dub. So we only hear these valves when they close. So lub, dub, and it should be lub dub, lub dub, lub dub, lub dub. You'll see it in some movies sometimes, but yeah, go hear from your friend's heart. So it's kind of cool. So that's how you make the lub dub sounds, and they're only made on the closing of the latches. So think of the hands. So open, no noise, close. That's lub dub, lub dub. And it's important to realize that because now we know that these are happening simultaneously. There's blood coming into our right ventricle at the same time that there's blood coming into our left ventricle. And they're both going into the aorta and into our pulmonary trunk at the same time. So we're having blood constantly going. And so these latches are the timed mechanism assisted by chordae tendineae and papillary muscles of closing and opening these valves, allowing unidirectional, so one way, one passageway, one direct shot of blood, and no backflow. So that's kind of cool. That's what I have for you guys today. Just to reiterate what we were going through and the direction of the blood flow, we're going to receive blood from the veins, the pulmonary veins, there's 4 of them. We're going to receive blood, oxygenated blood. It's going to travel down and in through the bicuspid valve. It'll fill the ventricle up, and it requires quite a lot of muscle and a larger auricle to push this oxygenated blood to our entire aorta. Simultaneously, on the right side of our heart, we're going to have our right ventricle fill up with deoxygenated blood from our entire body, which is collected at the vena cava. Vena cava veins are going towards the heart. It's going to go through the tricuspid valve, and then it's going to leave the right side of the ventricle through the atrium or reservoir, up outside of this papillary valve, and then it's going to go to the pulmonary trunk. Pulmonary trunk's going to split and go, portion of it's going to go to the right bronchi, and then a portion of it's going to go to your left bronchi, get oxygenated, and come back and repeat the cycle in the pulmonary veins. So cool, that's pretty much the heart summed up. If you guys have any questions, just send me an email, whatever you need to do. But thank you very much for watching, and remember, lub dub, lub dub, lub dub.